Okay, so hi everyone, I'm Jody from Health Direct. We provide the video platform that Rural Health Connect uses for your telehealth appointments. So when you join, you'll get an email from the team at Rural Health Connect to create your account so that you've got your own telehealth account. You just need to make sure that you do activate your account with the create your account link that's in that email. And it's really simple. You just need to set a password. Once you have a password, you'll have access to the clinic. So once a booking is made with your clients by Rural Health Connect, they'll send them the link to your clinic and let you know that you've got an appointment. And I'll just share my screen. Okay, can everyone see my clinic now?
Yeah.
Okay, so when you log in, it's going to look like this. So the waiting area may be a tiny bit confusing, but most of our health services that use our platform use a shared waiting area. So you guys don't, but what you'll see is you'll come in on the dashboard when you log in. And we update the dashboard every couple of weeks with new features and stuff like that we might have, which may be of interest to you. You can wait for them to roll through, or you can scroll through those. Most of the time, though, you're probably just going to want to go into your user room. It's called a user room, and that's the link that your clients would have been given. So you can come down here and click here and do all of that, or you can just go straight to your user room here, which you'll see. So dashboard and user room. So if you click on here, you can enter your room from here, or if for some reason you needed to resend the link to your client or something like that, you can do that from here as well. Or you can copy the link if you want to, if you're sending an email or something to somebody, and you can pop the link in there. But most of the time that's going to be done for you. So that's just if you would need to. Now I've sent myself the link and I'm going to come in as a client, if you just bear with me. Okay, here I come. Okay, so what you can see now is this is turned orange, which means that somebody's in there. So you can wait for that to happen, or you could have already entered the room and you'll be waiting for them. And if I go into my room here at my appointment time, is everybody seeing that? Yep, you can see that my client's trying to come in to the call. It's going to ring and I just accept the call there. And I'm just going to not do all of the awful audio that's going to be happening. Now, at the moment, Teams is using my camera. So let me just see if I can get that out of Teams and into video. Sometimes it doesn't work. Okay, so you'll see here, this is me as the client on my mobile. I'll put that down and you can see my ceiling, and this is you. So you're here. What you can do at this stage, if you really wanted to just focus on your client, you can minimize your own screen and just be seeing the client, or you can have half and half, or however you actually want it. And if you're just doing a straight video call, then this is really all you need to do. You've got the video happening here. There are a few options. If your device has a number of cameras or microphones or something like that, we've got a little settings cog here. You can go in and choose a different camera or a different microphone if you have one. You may find that too, it will always just look for your primary default device. So sometimes if you're not seeing yourself, it may be just that it's looking for a different camera than the one that you're preferring to use. So you can certainly pop in there, but most of the time it's just going to go straight to the apps and tools that your device is set up to use. And once you make a change in here, it'll stick for whenever you use it. So the other option that you might have is a blur background or some other kind of background. You can change that. Once you do that, then that also would become your like default background that you would ever use in video call, so that you can see there's a light blur on there. Most of those settings, it's a one-off thing that you might ever have to do. The other thing that you might find, particularly if you're using video call for clients that have really limited bandwidth, so maybe they're in a remote area or something like that. You can see here we've got a little green, excellent connectivity for me. Sometimes that's orange, sometimes that's red, depending on what your client's internet is like. If it's orange, you're probably going to be fine. If it goes red, you might find some issues with pixelation or a lag in the video. If that ever happens, you also have an option to pop in here to the settings and you can select video quality. So adaptive is the highest, and that's how it's set as a default. But you could drop it to high or standard. Even high works fine, and that will stabilize everything if you ever needed to. But a lot of these things you're probably not going to have to use. So we've got normal things in there, like you can mute your audio, you can turn the camera off, basic video functionality. Over here on the other side, there is a chat function that can be used either by you or by your client. You may there might be a link or some instructions or a medication name or something like that that you don't want them to have to write down, but you could pop that in the chat, or they could put something in the chat for you, and either of you can download the chat if there was just that little thing extra that you wanted to share in there. The other thing that we also have is a captioning tool. So you can turn that on. It's not going to show itself properly today because we're in Teams, but it'll give you a transcript of the call. And again, that can be turned on or off at any time. Both sides can download. So if you wanted something for your clinical notes or something like that, you could certainly turn the captioning on, and then you can both have a copy of what occurred. So that could be for the whole call. Works really well if you've got someone who's hard of hearing, or you don't have to use it at all, or it might just be a portion of the call that you would want it for. This little icon here is called the call manager. It just shows you what's happening, who's in the call. You can hang someone up from here if you want, but the main thing you might use this for is if you're in a session with a client and realize or decide that you need to bring somebody else into the call. That could be a family member or an interpreter or some other social support. Rather than having to send them the link and go back and wait for them to come in, you can invite a participant directly into the call. So if you click on that, and you can email them or text them the link to this call, when they activate that link, they'll pop straight into your call as well. So you can do that with anybody if you ever needed to have somebody additionally into the call. But that may not be something that you ever need to use, but the option is there. And then if you only needed that person for a little while, you can pop back in here and disconnect them when you're finished with them in the call. And then the final thing, and I'll keep it quite simple because there's quite a few things here, but probably not all relevant. In the apps and tools, you can share an image or PDF into the call that everybody can see. So let me just find something. And that'll open up anything that you've got there. So you can share, or your client can share a referral, anything really, a brochure, a pamphlet about something, and that'll share into the call. Again, downloadable on either side. And you've got all the pens, highlighters, all of that kind of stuff. So that can be annotated or drawn on. It's really interactive for both parties, and then easily downloadable on either side there if that's something that you wanted to use. I will just remind everyone that because of the security protocols of our platform, nothing gets stored by us that's shared within a call. It's all completely private. So anything that you do share that doesn't get downloaded before the end of the call will be purged. So just make sure that anything that you want to keep that may have been shared either way does get downloaded before you hang up. There's screen sharing options, whiteboards. You can play a video. I find, if you wanted to just play a video that's not a YouTube on a screen share, that would work really well. I'll come back to the billing consent, but we also do have a YouTube player. So if you needed to play a YouTube, it doesn't compete with the audio and video. That's the easiest way to do it there. And then we also have the bulk billing consent. So if that's something that you're going to be doing bulk billing, you can pop into apps and tools, click on the bulk billing consent, and then you fill out this part of the form. So the patient's name, your name, the clinic name, you pop in there, and then your clinic will be set up with a drop down of the MBS items that you might use. When you click on send to patient, which I'll do. Oh, I'll send that to the patient. That's come up on my screen as the client, and I just say yes to that. And then you'll see that there's been a consent, and a copy of that will automatically get sent to the email address that Rural Health Connect set up for archiving and auditing purposes. So that consent gets done there. And then we'll remove that. There's nothing needed to be doing with that. And really, that's basically, I don't want to overwhelm anyone, but that's the general functionality of video call. Does anybody have any questions?
Do we have to use that? I've been subscribing to Zoom Pro for a number of years. I see people privately. And can I continue seeing people on Zoom Pro?
That would be a question for Rural Health Connect, yeah.
Yeah, that would be yes. Yeah, we just paste that link into your profile instead, so we can assist with that.
Yep, okay, great.
Any other questions before I'll end this and go back to the waiting area or back to the dashboard?
Can you just go over, it's Susan here.
Yeah.
I just like the idea of capturing those notes.
Yeah.
So is that CC, is it, down there?
Yeah, so CC is closed caption. So when you turn that on, at the moment, because I'm on like a couple of different devices as well as Teams, it's just going to have what I say. But if the client talks, then that's going to come in and it gives whatever, the little name, then you've got everything there. And then you just...
Is that an audio or is it capturing it to words? Like...
It reads what you're saying. So, I mean, we'll always put the disclaimer that if, I would double check anything that's coming out if I was going to be using it for anything really official, because if it was like an unusual word, it could misinterpret what you're saying, but generally it's pretty good with with listening to what you're saying there. Some GPs will say if it's a really intense medical name or something like that, sometimes they aren't great, but it will give you an overview of what's been said. And like I'm watching this now and it hasn't made a mistake on anything I'm saying.
It's pretty good. It's better than Word, yeah. And downloading it?
It's just this little green download here.
Oh yeah, and you just download it. And
it'll download and it'll just go up into your downloads, and then you can decide where you want to save that.
Nice, very nice. I like it.
Yeah, so we built that. The platform didn't have it, but we built it for Hearing Australia. But what we're finding now is that like a lot of people are using it not for hard of hearing clients or patients, but for transcripts of the call, particularly in mental health. If it's a long consultation, you can just go back over it later and see for your notes.
Okay, all right, thank you.
Is there an option, sorry, hi, it's Nairi. Is there an option to share like a DAS form to patients?
You could, you could certainly share it, as a PDF, or you could share it as a document if you wanted to. So yeah, it could be shared, but it would be on a like either a screen share or a share an image or a PDF.
They couldn't, it's not an interactive, they couldn't fill it in while.
Well, there is there are the pens and stuff like that, but probably I think they're quite intense forms. I mean, you could take a pen and, I mean, you can draw in here or you could sign, but it's or
Well, it's only
cross something.
marking in a dot, so
Yeah.
might-
Yeah, you could certainly do it.
Okay. Oh, thank you.
Jody, Gary,
Yeah.
Bat here. What's the cost of it a month, the CoView?
It's funded by the Commonwealth for you guys, so no cost.
Okay.
Yeah, so Health Direct only exists. I mean, Health Direct Video Call exists to provide CoView to our fund providers. So primarily we're used by the state health departments in the hospitals, but the Commonwealth also funds a couple of programs for primary health. One of them is for GPs and the other one is for allied health, mental health, aged care.
Yep. Gotcha.
So
Thank you.
yeah, there is a cost, but not to you. The Commonwealth
Yeah.
pays for it. Yeah.
Okay. Thanks.
And that would be like, I'm not putting a plug, but any of you that are interested in using video call for your private practice for work that you do outside of Rural Health Connect, you can get in touch with us and we can
Okay.
give you access to your own clinic that you can use privately as well.
Right.
Any other questions? Okay, so when it's time, when you finish.
Can you put your email up?
Yes, I will. I'll pop it in the
Yes,
chat.
Thank you.
So when you're finished, you just click on the hang up. There is a little, it should be bigger probably, but there's a little reminder. Make sure that you save or download anything that you've shared in the call. And then you leave the call. Everything gets purged. There's kind of no record of that there for privacy. And we're back here. It'll bring you back to your room. And then you'll see I'm still there and I've gone as well. The only other thing possibly worth mentioning at the moment is when you're using this for the first time, there's probably nothing worse than doing your first call and something goes wrong, like it's not accessing your microphone or something like that. From the dashboard, you've got an option here, and again, it's a one-time thing to perform a pre-call test. So if you click on that button, it's going to, I won't show you the whole thing, but it runs a diagnostic. It'll look for microphone, camera, connectivity, and just make sure that everything is fine with your device and that we know what peripherals you're going to be using and stuff like that. And again, anytime in the future that you use that device, you wouldn't need to do that, but it just makes sure in advance of your first consultation that, you're not going to have to jump into the settings and and worry about any of that kind of stuff. And when the link gets sent to your clients, they also have, as part of their appointment link, an option to run a pre-call test on their device. If something goes wrong with the pre-call test, they're prompted to call us. And we talk to clients and patients all day long that have got questions about the general flow or their microphones accidentally blocked or something like that. So we'll help them as best we can. And in the event that, they have zero internet or something like that, we would put them back in touch with Rural Health Connect. But we're here. We have a support line, tech and admin support Monday to Friday, 8 till 6, and that's available for you guys and, for clients and patients as well. So we'll do whatever we can here to make sure that everybody's, able to use it. And that's it.
Brilliant. Thank you, Jody. Well, that's actually really useful for me because it's not something that I see every day as well. So now when people ask me questions, I might be able to answer them a bit more clearly.
I'm always happy for them to come here. You guys have got your work that you need to do, and this is what I do. So I mean, it's good to see what it's like, but yeah, certainly never hesitate to get in touch with me, and I'll pop my email address in the chat if anybody wants to talk about anything or has any questions, either, you know, for here or, sorry, Megan, externally from here as well, if you've got any video call questions at all. And yeah, if there's nothing else, I'll leave you to get on with the rest. And hopefully I didn't take up too much of your time.
No, thank you. That was wonderful.
All
Thanks,
right,
Jodie.
great. Thanks, everyone.
Thanks,
Thanks.
Jodie.
All right, thanks. Bye. Well, I don't know if I should talk or you should talk, Naomi. I'm happy to, but anyway, we'll just we'll jump in.
All right.
Oh, is everyone
So,
gone? Oh no, no, that's all right.
lead the way, boss.
Well, I can share my screen and just show through some basics of how everything works. But actually, it might be good. I'm just going to put it, if I put it on this, it might be good to just briefly introduce like what we've been funded to do, just because I think there's been there's been confusion in that no one exactly knows. And we've been sort of getting it clearer ourselves over the last couple of weeks, I guess, since we've got everything underway. But so Rural Health Connect is a social enterprise telehealth service, and we've always focused on the rural and remote area. And so we've been funded for a portion of psych therapies under this new contract. So I think we've got about 10% or something of the total amount. And we have been engaged primarily to cover the rural and remote areas of the PHN, so across the 3 regions, but with a focus on those rural and remote areas and those people who would otherwise find it hard to access support, because that's sort of what we do. So it's great to have everyone on here, and I know that many of you are working in towns, and if you've been working under the old system, and hopefully we can support what you're doing, but also I guess the limiting factor for us is going to be we've got a finite amount of funding, and so it's just going to be working out how everything works, and like I think we're going to be able to do about 35 sessions a week. So like the simple maths are it's not going to fill everyone's books up anyway, unfortunately, but we're here to help, and we're here to make that work as well as it possibly can for all of you, within the boundaries of what we're able to do, which is mainly those financial ones. So we are here to provide support, sort of like admin support, within reason of also what we're able to do. But definitely we help you in any way we can, either with clients, with booking, with paperwork, with whatever else you might need. I'll just share my screen, and please ask questions at any time. I'm just going to do entire screen. I'm just going to share my screen and then log in as a provider. So this is what you will see when you log in, something like this. Now, basically, the way our system works is we are allocated referrals on ReadyCase. We will pull them off ReadyCase, put them onto Rural Health Connect. We'll then call the client and just talk through the process of telehealth and what they can expect, send out a link to their phone and email. They then put in the areas of interest they're wanting to work on, and they'll see those providers that might suit, as well as the availability, and they'll then make the selection of who they think's right for them, and register. And once they've done that, you'll get an email saying someone's booked in with you. And if you go to your calendar, you'll see that client booked in. And then we'll also then allocate that client to you on ReadyCase for the reporting side of things. So what that means is it's important that you have some availability in your calendar. So they'll only see you if you've got availability for new clients in your calendar, and then they'll see those times that are available. So I guess, you know, even if you're going to have just a few spots each week for a couple of weeks, you know, in the future, that just gives people time, you know, and some options for, if they want to book you, some options of finding a time that might work for them. So to set availability for new clients, you just click on a time slot, and then you go to this one, available North Queensland PHN, and select, and that spot will then be visible to new clients. You can make that recurring, you can drag it around, you can, and then if someone rings you, a client who's already in the system, and you want to book them in over that spot, you can just do a double click in that little gap next to the spot and select the client from the drop down list and press save, and that puts them into the booking. If you want to book that, say if you've done this session and you want to book in the next one, you just go forward to the time that they want, might be here, double click, select the client and save it. That client will then get the automated reminders. So they'll get an email saying you've been booked for a session at this time on this date. Then 4 days out, they'll get a reminder saying you've got this session booked. Your provider's set this time aside. Please let us know if you can't make it. Then the day before, they get an email and a text reminder, and that reminder has a link in. It has the link to your room in there. So then, and it says, please click on this link at this time, and that will take them into your Health Direct room. The question, billing, important. So that once the session has been completed, then it will appear up here. Now, this is really important for us to know what's happened and what hasn't happened. This here is meant to say $150. That's not zero. I don't know why it's swapped to zero, but we'll have a look at that. But basically, each of these are individual sessions, and these are the client names. So you can go here. If it just happened as normal, you tick that box. You can make any relevant notes here if you want to just these are notes.
You have to put a note in if they DNA.
Correct. Yes.
Yeah.
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 Yeah. We just want some details. Yeah. Yes, you do. And so, and these are notes related to invoicing, not, you know, anything clinical, but just telling us what's happened. So yeah, so that the DNA might be, you know, where's that working? Oh, I've got to do a note first. That's right. Update note. Okay. So, you know, tried to phone several times, phone off, said text, something like that. I don't know what it might be. That's more of a clinical stuff, but I guess we just want to, it's useful for us to know that, or that, you know, that the right thing's being done, I guess. And that's going to be good for us to have recorded for DNAs, and then you can mark as DNA, and that will go. So for our invoicing, you just send an invoice, including this booking ID number. We're thinking the first name and the last initial of the client, and the time and date of just the date of the session would be great, and for $150. And then you can mark it as invoiced here, just so that you know, so you don't send multiple invoices. We're still refining this. But you know, it's just, we'll try and keep everything as simple as we can. So if anything is proving cumbersome for you, let us know, and we can adjust and adapt too. But I think we're going to go through and just pay invoices each Friday. So that's that. We do have we have a DAS 21 So if you want to send them, you
Sorry,
can.
I have a question about billing.
Yeah.
Do we, so previous, the view.
Sorry. I like that.
Yes, we've been asked to put the ready case number on there. That's something that our clinicians don't do the billing, and the clinicians only get the ready case access. When you're setting up them into the Rural Health Connect, can you just put the ready case number as a part of like their client file number or something? Do you know what I mean?
We could add that
Um,
to the notes.
Yeah. That way
that
we
as a
don't have to
client
go
note in
through
there.
this then ready case and then our own to do the billing.
Sure.
It's
Yeah, look,
just like
that
3
sounds a lot.
softwares. If we
Yeah,
only
for
have to
sure.
use 2, that's a bit better.
So have we asked you to put the ready case number, or?
I think one of the latest emails asked to also add the ready case number in addition to
Yeah.
the bookings ID. So, and then
That's
that's
just
how
to
we
help us to reconcile the two, just to make sure
Yeah.
all the sessions are added to both platforms. So
Yeah.
that the rural health, we can pay you, and so the PHN get the information they need. So
Yeah.
when we're setting up the client file in Rural Health Connect platform, we'll just stick the ready case number in a note as well.
Perfect.
So
Yeah,
if you
that would
can
be
just
great.
check that. Yeah.
Yes. Yeah, that would be great, just to save us going to 3 different platforms from our perspective. Yeah, for billings.
And this will definitely be a work in progress. If something is difficult, just let us know and we can simplify it, because it's not my area of expertise, anything to do with invoicing, and that already makes my brain hurt thinking we need this number and this number and this number. And this. I don't know. Anyway, whatever, we'll get there. But we want to make sure that we get it right. Obviously, we don't want to be missing any payments or paying any extra. So, in whatever way we can do that, we'll do.
Naomi, Gary Batt here.
Hi, Gary.
I mean, Megan, sorry, or Naomi. What I'm finding, I've got about 4 on ready case that haven't come up on the system. And what clients tell me is they sometimes think that registering my interest of areas of grief or depression, they think it's just a survey. They don't know they've got to fill it out often. So I've got 4 sitting there that aren't coming up. They're in ready case, but they're not coming up on the dashboard. You know what I mean? So our clients aren't used to kind of making the booking. They kind of have connection with you guys, and then I think usually it's the clinician, or my experience is I do all the booking side of it, So do you find that's a problem, not just with me or with others?
Not typically.
No. So I've got 4 there on ready case that I'm trying to get in touch with them to say, you need to fill out whatever registration link that was sent to you. You need to complete that or return it with information back to Rural Health Connect. Because they don't always do it. They think it's just a survey or something like that,
Generally speaking, people aren't going to be linked to you in ready case until they've registered with us, because the process is we receive the referral, we send out the link, they choose their provider, and as part of that process register, and then we'll link them in ready case. So this might just be in this sort of transition time if you had some existing clients or something.
Yeah.
But they will need to, I mean, that's how we collect their like emergency contacts and, address and sort of those sorts of things that we need to have in the system before the session anyway. You might have them, but so they will need to complete that registration form. So we can resend it. If we know who they are, we can resend it, and then they can just do it.
So there's 4 I've got on. Go on. Sorry.
Oh no, I was going to say, once they're registered, once they're linked to you in our system, it's very easy for you to then put them into the calendar at the spots where they should be. It's getting them in our system.
Yeah. So
the barrier.
I'm a slow learner. So can you just go over that again? Like, what actually happens? They come into ready case, then you contact them. Is that how it works?
Yeah, that's right.
And then after that connection happens, then they're on the Rural Health Connect system as well as ready case.
Yeah, that's right. So we'll see them on ReadyCase. They should not have a provider allocated to them at that stage. That's something that I have seen a little bit of. If you're seeing somebody allocated to you on ReadyCase, but that is not on the system, then that's just a bit of an indicator to just hold firm. So we see them come in on ReadyCase, we put them on the rural health platform, we give them a call, we tell them what to expect and how to get connected to their provider, how to make their booking, and they have our mobile numbers at that point, so they can ring us back if they need problems, or we can work through it in real time with them when they call, when we speak to them. And from there, you'll get a notification by email from the platform to say you've received a referral. You'll also, at that point, we also see that the person has been registered. So they start as an invited client and then they become a registered client. So we check that registered list every day. And as new people register, we update ReadyCase, we'll accept the referral, and then we'll assign the provider. So that at that point, you'll get your second email. So you get one from the platform and then one from ReadyCase.
Okay.
And so until you get both of those emails, you know that there's still something that needs to be done
with them. Okay.
And I think, and it is like we need everything to be in Rural Health Connect so that we can keep track of how many sessions we've done, and we've also got quotas for the different regions. So we're going to have to we'll work through how we sort of make sure that we're meeting the different quotas for the different regions for clients. So we need everything to be in Rural Health Connect, but then also in terms of reporting, I'm not very familiar with ReadyCase, but I know Naomi's had more experience with it, and you all obviously have. But there's certain things that we need in ReadyCase, well, the PHN requires really, isn't there? And I'm sure you're all across. We need all sessions to be.
There's usually an urgency from my NQPHN ones. I tended to want to make sure this person, it's actively being followed up. They're getting some help, like, so I've got these 4 sitting there. Some of them I've never met before. I've never known. They're not former NQPHN clients of mine. And and they're just sort of sitting there.
So I'm just looking on ReadyCase at the minute, Gary, and I haven't got anyone in here that's been assigned to you that's not been accepted. So they don't get accepted on ReadyCase until they've been through the process on the rural health platform. Maybe we can take this offline and dig in a little bit deeper later, because this is the only you're the only one this seems to be happening to at the minute.
No, that's okay.
Can I just ask a question, please?
Yes.
Hi, I'm Fawn, not Emily. I'm using my daughter's laptop. But I've just got a few questions because I really don't understand how this is working. So who actually assesses the clients? Is that Head to Health?
Yes.
Yeah. Okay. So they assess and then they decide which of the agencies they're going to send it to.
Yes.
Correct. Yeah. Okay. So then what about my current ReadyCase clients? Because I'm still seeing clients from psychological therapies. So do I have 2 different ReadyCase? Will I have 2 different logins, or how does that work?
Yeah. So at the moment you are seeing clients under the Connect to Wellbeing portal, the environment on ReadyCase. So those will be, you will finish those off and close them. And eventually that login you won't need anymore. And you'll just, your primary will be within the Rural Health Connect environment.
Okay. Now, can previous clients see me again? So I've got clients I've got one that I've just closed off. She desperately needs to see someone. She probably wants to keep seeing me. How does that help? How does that work?
So the Head to Health phone service are the gatekeepers to psychological therapies now. So once you've completed your current episode of care with a consumer, you close them on the books and you let them know this is where it's at. And if they need further sessions, they can call the Head to Health phone service. They'll have an assessment and they'll be navigated to the most appropriate service. They may need something more intense. They may need something less intense, but that assessment will help the team to navigate that person. They can also go back to their GP and say, look, I've been seeing Fawn. I really want to keep seeing Fawn. And the GP can make a note of that on the referral, but at the end of the day, it's still going to come down to capacity and where that person lands on the assessment, and at the team will still need to navigate that person appropriately. They do take into consideration that request for a particular provider, but it's not guaranteed that it's going to go any particular way.
Okay. So how would Head to Health know where I can be seen?
They will refer to Rural Health Connect, and the consumer can select you from the portal when they get that link.
But how would they know to send the referral to Rural Connect and not some of the others that have, because you said that you only get like 10% of them.
Yeah, so you could ask that client to just say that you can be accessed through Rural Health Connect, and the GP can pop that onto the referral form as well. So it'll be like Fawn via Rural Health Connect.
Yeah, sure. Okay.
Yeah.
And do we know how many sessions? Do we know how many sessions the clients get?
There's no caps. So, but equally, there's a finite number of funded sessions. So, and we're going to be very mindful, you know, like it's really hard because, and I think the PHN are going to be working this out themselves, but there is no limits, but equally we want to be able to help as many people as possible. So it is going to be a delicate balance that we'll.
So they're still trying to assess that, how that's going to work.
Yeah, I guess we're hoping that.
Yeah. And will it still be a referral from a GP? And like it did, like it was with.
Ultimately, not necessarily. It's going to be not restricted to GPs. So I think they want to have, like, you know, no wrong. Like people can come in through a number of different ways. But I guess everyone's going to be doing what they know for a while, so there'll be a bulk of them from GPs. But no, not specifically. But they will all go, for the time being, they're all going via Head to Health, and then people can self-refer and that sort of thing, I believe, as well.
Megan, just a quick question. I spoke, I think it was last week, to Head to Health, and they suggested to transfer clients over, we could do a referral email to Head to Health, like advising that we've seen the client before and they'd like to continue. And just in relation to the face-to-face or phone or video, I just want some clarification around that as well.
In terms of like the specifics around that, I'm not sure, but if they say that, sure. I mean, there's got to be a way to sort of work through this transition time and everything. So, yeah, with face-to-face, so we have built in this capability. I think I got a little ahead of myself, apologies, and said it was on there when it was only on there in a test environment. But it is due to be on there soon. However, what we've been told from the PHN is that they largely want us to meet the rural and remote need, and that's why they sort of engaged us as a telehealth service. So if you're all offering face-to-face in the towns, that's sort of going to allow, and our sessions get used up there, then we're not going to be able to meet the need in the rural areas. So we've certainly got the capability and we can do it, and I'm sure that there is the need, but we're just going to have to see as time goes on how many rural referrals there are and whether we're the ones who are going to be, doing them all. And if so, we may not be asked, we may be hoping that you don't sort of use that face-to-face feature that we've just built. So I don't know. That was sort of what the PHN communicated to us yesterday. Probably not ideal for you guys, but yeah, we are really just restricted by the numbers that we're able to do, and then we've got to just focus where we need to focus first. So we'll keep communicating with you about that face to face, but at the moment we're not anticipating that that's going to make up a large portion of the sessions done
So
through our service.
Megan, Susan here
Yeah.
again. If you only got 10%, who else has got the 90%? Because like we
No
are
one,
and Mackay, well, I'm in Mackay, a couple of us are in Mackay. So is that regarded as rural? I don't think so, is it?
no, the town's not so much. There's 17, I think, funded or something, through the program. I don't think it's concentrated anywhere. I think it's sort of spread across a number of providers. So, yeah.
Well, they only put a couple on there that got it. So, yeah, not 17.
You can find the list of stepped care providers on the Head to Health website.
Is there 17 there?
There's a lot.
It might be 17 in total across, not just psych therapies. I'm not sure.
Rightio.
So I'm concerned that I am in a rural area. I'm in Innisfail. We didn't receive there were no tenders in our area. So I'm very concerned that the Cassowary Coast will miss out on face-to-face appointments, that they don't have any access to that.
Yeah.
So I'm very keen to offer face-to-face.
That's fine. We're going to be given specific regions from the PHN where there is a need, and we'll enable it there. That's not going to be our decision, so that will be coming straight from the PHN. But I believe that that's your area, Fawn. So yeah.
Okay.
Yeah. Do you want me to? I didn't finish showing you the DAS 21. Is that of interest? Do you want me to show you how to do that while we're here? Yeah. Okay. I will quickly do that.
Just while you're sharing screen, Megan, Marikai, did you have something? I see your hands up there.
Oh, sorry. It was two things. I know that I've got someone on my caseload that was a no-show, and it's just kind of not gone anywhere. So I wonder if that's maybe something on Gary's end as well. And yeah, it was just also that wanting to know, which I think you've answered already, but where the rural locations are, and if we're receiving referrals for places that aren't that, should we, because everyone that I've received is for a city, and if that's using up the 10%, like the 35 sessions a week, should we let someone know?
We'll do that. We've just been working out what's expected of us, over time. So we can definitely do that, and we'll be communicating back to Head to Health, like which referrals should be coming through to us. So no, we're not going to, in time, this should all just flow more easily, and we don't want to be, we hope we won't be having to knock people back and that sort of thing. Whoops. Yeah, okay. So you can send letters via our platform. This because this is a test, might not have the whole. Yeah, there's a video there's some videos in the help section that sort of talks through different features, but in here, I don't use this send form to client survey DAS 21. So this can send the DAS 21, and it does do the maths as well. So if you want to send this ahead of a session, you can just select the client there, select send form to client, select which of these you would like to send, and then press send. They'll receive an email telling them to log in and complete it. You can also do consent forms and that sort of thing on the system if you'd like to. There is a video there, but you can upload whatever consent form you want and then send it through a very similar process, that quick action. And then that will, and then they can just sign it on their, using their finger on the phone or, you know, on their cursor. Just trying to think what other features might be relevant to yourself.
Don't most of the clinicians have that in their own software already?
Yeah, likely. It's just if you want to. So, yeah.
Okay.
Yeah. So, I mean, I think, look, the main thing is to just have some availability in the calendar, so then we can get people booked in with you. And then, yeah, aside from that, like, I don't know, like, are there any questions? Has anyone had any issues or?
Sorry, Olga here from Alliance. Just a quick question in regards to availability. So if we don't have anything open future dated, the clinician does not come up as an option to choose from. Is that correct? Yeah. Okay. Because we had a phone call today and they said the same thing. So I thought it's probably due to not having availability open up far enough. Yep.
Yeah.
And I had a question as well, Anna. I haven't received any login for the second Ready Case account. I just wondered what that process.
Anna, you registered through a link for Amanda, is that right?
Yes.
Yeah. Yeah. So
I didn't receive a link, so I ended up registering through her.
Yeah, so there's some checks and things that need to happen, and I believe one of our team members is doing those at the moment.
Okay.
And then we can complete the back end of that piece of work.
Okay.
From there, we can set up your Ready Case login, and you'll get that notification from Ready Case directly.
Okay, lovely. Thank you.
Oh, it's Terry. With regards to the calendar, is there a save mechanism that we should be using?
Yeah, once you select the time, then you'll see a little save button just below. If you select available for new clients and then go down a bit, you'll see save, and then that puts it into the calendar.
So what about when you're updating the bookings? Is there a save capacity there?
Yep. You should see a save button on there, and then whatever you do, you then look at the calendar, you should see either the booking or the availability in there.
Okay.
Oh, actually, and so once someone's in there, if you click on their name, you'll see, oh, actually, I should just show this. I don't think I showed this before, sorry. Once you're in there, if you click on a booking, you can go to profile, and this has got their details. So you can normally, but it was what they're hoping to get out of the session. Emergency contacts are in there, address, that sort of thing. Files is any paperwork. So we'll upload any referral information into files, which you can download from there. You can send them an SMS here, and it will automatically paste in here is the waiting room link for Health Direct. So you can say, you know, I'm waiting in the waiting room, send, and they'll get a text, and it will include your room link, email, files is the paperwork, and that's, yeah, they're the most important ones. Sorry, I hadn't showed you that before.
Megan, is the number of sessions the same as it was with Connect to Wellbeing?
No, there's no limit. So it's more on your.
So they don't get like a minimum 6 like they do with the GPs, and no.
No, I think like we've just in our own conversation thought that the GPs are still going to want to receive those updates because they're going to want to know, you know, how they're going. So I still think that would apply. But in terms of this program, there isn't a cap aside from just the fact that we hope that, you know, if someone can be suppose that they will be, just so that then we can help someone new, because we do anticipate capacity issues in time across the program, just because of the demand and the need.
Okay.
Susan, if you've got, look, I'm probably unlikely to get too many clients, but I'm just thinking, like, we've done a number of, for years now, PT and SP, so suicidal clients. So if we have to upgrade, if the client's suicidal, do we have a link there through you guys?
I think that would be head to health. I think.
So
yeah, we're
taking
not
the
doing.
client back to head to health or something, or you phoning head to health?
If someone,
Sorry, there's a service that is trying to support clinicians when someone becomes suicidal. So rather than stepping up to SP, they're wanting to provide, like, real-time sort of supervision to, how to support you with each kind of different presentation when suicide becomes apparent.
So who's doing that?
I am terrible with names. It's something like Wellmind, or they're very big in, like, that kind of spinal space historically, and also working.
I'm actually Wellminds, but I think it's
no,
open,
maybe
Open Minds.
Yeah, Open Minds.
Oh yeah, it is. Yeah, Open Minds. Yeah, they've been funded to do the suicide prevention. Yeah.
Yeah, but do we have any sort of links for them? So if we get a suicide client,
they're not providing therapy, so they're just providing clinical support.
Oh, so who's doing the therapy for suicidal clients?
There is different people for different regions.
Right.
So I think there was, like, a slide or something that came out. I saw it, like, ages ago. But Open Minds is about supporting, like, the individual clinicians in the moment if they feel comfortable holding on to the person. Otherwise, I think maybe Northwest is one of the big ones that previously ran the MIC program, and that's been extended. But I'm not 100% sure.
Okay, thank you.
We can find that out from the PHN, and
that would be really good, because the system as it did worked really well, sort of thing, of getting suicidal, because this is a very big concern, especially in rural and remote areas, of suicide. We had 2 down in local area just recently, so I'm really concerned that they really need support. That's all. Thank you.
Any other questions? America.
I just had a question about scheduling appointments. If you put in an availability for, a new person and a current person, can you put them at the same time, and then if someone books it, it blocks it out? Or do you have to put in a bunch of different times?
For a new person? Oh, sorry.
So you know how you have to have, like, that availability for, like, new and current? Are you able to book them both at, like, 1 o'clock on a Tuesday, or do you have to do, like, 1 o'clock and then 2 o'clock? And, like, if you
yeah, look, yeah. So if you have a new client availability in there, existing clients can book it. That's sort of, we have that feature sort of more for admin in case they ring and they want to book in with you, and we know when you've got spots, but maybe you don't have capacity to take on a new client. At least we can see that you've got a spot there. But generally speaking, the new client spots are they're the ones that that we'll use, and they're the ones that come up for booking. So those existing client ones, you can tell your clients that they can log in, and then they'll be able to see your existing availability and book it. But most of the time, you'll be booking in their next session at the end of their previous session anyway. So whilst useful, it's probably not something you use a lot, I wouldn't imagine.
So we can book ourselves the next session. The existing clients, we can go in and do that. We don't need for them to be booked. Okay, cool.
No, absolutely. So you go forward to the time, you click on it, and instead of setting availability for a new client, just below that,
Just
there was
select
that
the client.
Yep. Exactly. Yeah.
Yeah, perfect. Yeah, so we've done our availability purely for the new initial people, assuming that we will continue booking recurrent ourselves rather than. Yeah, excellent. Thank you.
Yep. Perfect.
Just wanting to ask a quick question before you go. So I haven't put in many forward bookings because I'm a little bit concerned that with my clients that may come over from Connect to Wellbeing, then I'm going to overload myself. So what I was kind of wanting to know, if I make availability for new clients, but they haven't come through yet, I know they are contacting Head to Health. Like, how do I make these appointments available for the clients that I've seen before without getting 10 other new referrals as well? Because I have a couple of spots for new clients that I don't know, but I've also got half a dozen perhaps from Connect to Wellbeing that are likely to come over.
So you want to be available for your existing clients to come over, but not for new clients at all?
Well, a couple of new clients, absolutely, but I just don't have the capacity to take on 10 new clients, plus my other ones if they come over as well. So
we've been opening only 2 spots per week per clinician at this stage, just to.
So new spots for your existing clients through Connect to Wellbeing? No.
Through new people. Yeah.
Yeah.
Rural health. Yeah.
See, I don't have capacity to do 2 new spots a week at the moment. Yeah, I've only got a couple of spots for like brand new people. But the existing clients aren't actually my existing clients yet because they're not registered on the system and it hasn't come through. The referrals haven't come through. But I know
and
they're
it's
coming.
important to bear in mind that they possibly may not come through at their assessment with Head to Health. They may be navigated to alternate services as well. So that's important to remember. But what we could possibly do, Brenda, is just if you can open up a spot that you know that if it is a new client that you can accept it. And then if that happens to be someone who's already existing, beautiful. But if that's filled with an existing client and we get somebody on the phone and they specifically want you, then we can do some work in the background, and we'll probably have to involve a phone call with you or some email with you just to get that happening, because obviously we don't have access to your typical calendar, so we wouldn't know when we could offer that. But it would just be a little bit more manual handling between us and yourself and the client to get them hooked up, if that was the case.
Sure, thank you.
Does that sound? Am I on the right track there, Megan?
Yeah, I'm just trying to think of the easiest way. It might also be if you do set some availability for existing clients, that would just allow us as admin to see when you might be free. So then when these referrals come through, we'll have to swap it over. We can see when it might suit, but those spots don't come up for new clients. So it's more just a way for you to let us know when you might be able to take these people on. And then if they're coming through with your name on, as a whole, the PHN doesn't want that to happen. They want it to be like a process. But I think this is a transition time, and for people like yourself, we just want to make it as smooth as possible for the clients and for you guys, and just get everything underway. So if they're coming through with your name on, and we can just see when you might have some capacity, we can get them booked in that way without you getting overloaded.
And I am trying to find referrals elsewhere, but there's still half a dozen that will need ongoing support. And I think this may be a bit tight.
Okay.
Yeah.
Yeah. Any other questions or? Well, we're on the way. Like we're sort of, we're getting there, I think. So we want it to work for you guys. We want it to be easy, and we want it to work for the clients and everything. So any feedback or concerns or or questions, just let us know anytime.
This might be actually a good time to introduce Karen. You guys have all met Karen before, former Connect to Wellbeing Warrior in the allocations team. Karen is going to be, I'll be handing over to Karen today. I'm going to play in another sandpit, and so Karen will be your new go-to for all things referrals and all of your questions. So if she doesn't know the answers, it's because I haven't given them to her, or I maybe haven't, or maybe I haven't even had to answer them myself yet. So be gentle with her. But yeah, she's a powerhouse. You've all worked with her before, and she's great with ReadyCase. So we'll just get her up to speed on the rural health platform, and you'll be cruising. Yes, so we'll send out an email. Thank you for that question. Contact details, we'll send them out for Karen. Karen at ruralhealthconnect.com.au, and when she gets her phone, you'll get that number as well.
Yes. Hello, everybody.
All right. Well, thanks for coming, and thanks for working with us on this, and your patience as we've got everything up and running. But it's great to be working with you. Yeah, and we'll look forward to speaking to you more in the future.
Thanks for your time.
Excellent. Thanks for your time, guys.
Thank you.
Thanks very much.
Bye.
Thanks to Naomi too for getting everything up and running.
No worries.
Thank you. Bye.